I can say, if I were in your position, I would take with myself and hand over to someone else who is not compromised.
Thank you very much for your support. Welcome, everyone. In today's views, we will take a look at Damion Crawford's presentation in the Senate over the weekend. Some people, let us get into it. Leave your views in the comment section below. And if you are new here, welcome. Subscribe to the channel to help the channel grow. Thank you. Bless up.
Thank you.
Senator Crawford.
Thank you, Mr. President. Unfortunately, I am not in my pink
And you have my permission to speak from a seat
today,
that
and I
is
thank
not
you for the permission to speak from a seat other than my own. The pink shirt couldn't fit me this morning. I must be thriving myself. But I want to also recognize Senator Longmore not only as a survivor and a thriver, but also an example. An example to many of sticking to the task and being confident in the outcome. I myself have been close to you through this space and have seen your excellent recovery. And you, my love, by looking at you, no one would even assume that an ailment or an illness has ever besetted you. And as a consultant, indeed. One way we can be better together is through a national health insurance. Because there are so many sufferers of cancer that has suffered from health poverty due to the cost of fighting that disease. And a national insurance allows for all of us to combine to create an avenue, especially for those less informed and less equipped financially, to be able to get the necessary treatment and to have the types of medical checkups to find it early. A lot of the delay has also been educated by a lack of financial capacity to where healthcare is not prioritized in spending. We can be stronger together with a national insurance. Another way to be stronger together is to work with our partners in medical care and medicine. There has been undue delay in the approval of medication in Jamaica. That has caused for us to be, in some cases, 3 iterations behind as it relates to the upgrading and improvements. And one of those realities is because we have not worked together in procedures where the FDA, the US, and the Canadian and the Europeans have approved drugs. We have determined that we must approve it ourselves as well. And like many countries with visas, we could always accept 2 of the 3 established countries in the world. If it is approved by the European Union and or the US and Canada, then it is reasonable for us to accept any 2 of the 3 and move to allow our people to access upgraded medication and not have the backlog that has caused for, by the time we approve item 5, they're at item 10. If we were to act the same way with the iPhone, we would have been at the iPhone 10 and not 16. We can work together. Well, based on his income, many phones have very high income now. We can also work together and be stronger together by recognizing the importance of women to our society and to encourage lifestyles that can not only increase the ability to recover, but may also reduce the likelihood of the experience. I learned recently that the least exercised group in this country are women over 14 years old. Over 14 years old. And if you 1-4 exercised. And if you look on any street, men playing football without an organized activity. Most MPs have a football competition, and very few would have a netball competition, and even then is way less entrance. If you just look at the national stadium for championships, many boys, especially after class 3, much less girls. And you have the football competition where all the boys participate. And then you have the cricket that all the boys participate. But how many girls are participating in exercise activity even at the school level? Our culture almost assumes that ramping is out for adolescent girls and adult girls. And so when a 40-year-old male can go and play basketball, for which we have made basketball, quote unquote, / netball courts dominated by basketball only. A lady who goes out to, not at the gym, but just to run around or to play, might be frowned upon by our culture. She'd be asked if she don't have any children to cater to. And so, when I saw the activity of Jamaica moves, that marketing effort to encourage participation should be extended to a direct effort to have women and girls participate in more exercise activities, especially ones that are not paid gym membership organized. The final is to have centers of excellence in women care. I have met with the chairman for the Linstead Hospital to ask that we make a plan for the Linstead Hospital to be a center of excellence for female care. And I accept that men are also affected by breast cancer, but predominantly women. But what I also accept is we have a 47% single parent experience. And within that 47% single parent experience, the vast majority are women-led households. And therefore the impact of illness to our women becomes a greater impact to our society because of what that means for our children. One of the reasons identified by the University of the West Indies for absenteeism in school is mother's ailing, or mother's illness. Notice I never said parent's illness, because the mother being ill is oftentimes the sole provider being ill. Finally, I want to add what was discussed last week about mental health and stress and the impact that stress has on some of these ailments showing themselves and increasing their speed. Well, we too are stressed. But as we allow men to separate themselves from the family with economic benefit of doing so, it increases unfairly the stress on the women who then become everything to the family. And the ease in which they should have had the ability for the court to intervene has never been looked at in our society. And also getting, child support. And also getting the reduction, protection from abuse. All of those have created great stress and contribute to many ailments that we have faced. So I hope that we take this day as a day to work together to firstly have an insurance scheme, even if it is at the start directed to things like breast cancer initially, medication, treatment, testing. That we work together to have approvals of medication in a manner that causes us to have access to the best medication. That we work together to ensure that clinics and hospitals have the necessary equipment and doctors and gynecologists and radiologists and all of those things for adequate women health. That we work together to encourage a lifestyle of health among our women in nutrition and exercise, and that we work together to reduce the stresses of the society by realizing that family is a partnership for which the men should play an adequate role, whether by choice or by force through the courts. Thank you, Mr. President.